As you may already know, not all movement practices are designed equally. In the LIT yoga method, we help you retrain your brain and body to move better for everyday life. Through physical therapy drills, yoga, functional mobility, core stability, and flexibility, the LIT method rewires habitual movement patterns and postural imbalances to help you feel stronger, more energized, and more balanced both on and off the mat. Our online platform, the LIT Daily, is designed for easy convenience with a robust offering of class types so you can boost your energy while getting stress relief. Yes! Improved brain wiring means you will move with more ease and efficiency because we teach you the how and why behind movement choices, not just poses for the sake of poses. All movement teachers on the platform are certified by LIT and share a common language, providing education with clear cues that give you the needed reinforcement for enhancing your movement habits. Thousands of students in over 60 countries get LIT to feel more confident, more powerful, and more alive. We offer 2 subscription options for all levels and bodies. The LIT Daily option includes library of 500 plus classes with so many categories, including short on time, injury prevention, stress relief, and body parts. Tuesdays and Thursdays, we offer live classes streamed on LIT Daily. There's a class of the day to help you take the guesswork out of what class to do, and monthly workshops are 50% off. Then the LIT Studio option has everything I just mentioned in the daily option, plus 20 weekly live Zoom classes with LIT teachers providing real-time feedback. There are monthly workshops that are free for these studio members. You can stream all of this right to your TV Air device through Android, iPhone, and iPad apps. Movement changes everything. When we move better, we feel better. So sign up for our free 1-week trial and see how getting LIT can help you feel your best today and for years to come. I'm Laura Hyman, and welcome to Redefining Movement, a LIT podcast designed to investigate all aspects of movement from my background in physical therapy and neuroscience. My mission is to help everyone find freedom through smarter movement patterns and compassion for ourselves and others, so together we can live our most uplifted lives, benefiting all beings. Welcome to Wednesday Q&A, where you all ask the questions and we answer with pleasure and joy because we love being together. I'm joined, as always, by my comrade in arms, well, she's got good arms too, physical therapist and senior LIT teacher, Kristen Williams.
Hi, Laura. She's got great arms too. My mom always comments about how strong you are. Every time she sees pictures, she's like,
oh my gosh. Well, wow, you just made my day, Mama.
I know.
Mama Barnett. Okay.
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 What's the first question for today?
First question is from Be Up Yoga, one of our teachers. In case of an injury, say a muscle soreness or twisted ankle, would you still recommend ice and cooling or rather moderate heat? I'm confused by the internet. Thanks. I think everybody is confused by the internet, and I'll just launch right in because I just happened to have a little injury the other day, and this is a perfect example of what I would do. So I woke up in the middle of the night. It was dark. I was half asleep. I was purposely trying not to wake up more. I overshot coming around my bed and walked right into a very, very heavy wooden leg to a chair and hit it right on my ankle, my medial malleoli. And at first I was like, oh, okay. And then went to the bathroom, came back, and then I was like, this is actually kind of a big deal. And because it was painful. And I went back in the bathroom and it was like a golf ball had just started right there. And so what I did immediately was wake up, but I happened to have some arnica cream and I started to rub arnica cream on it. And I started to massage. And I do believe that if you can get some early, the swelling is there for a reason. It's your body's response to an injury. Swelling happens because the body wants you to, and very big swelling. So it's kind of in hand with like the degree, but a lot of swelling is is preventing movement. So you're not going to further injure it. So we want, just like if, they say like when a kid has a fever, it's actually better to let them, that's your body's natural reaction to heat up, to kill off bacteria or whatever. So trying to get their fever down might be counterproductive at a certain point, obviously, if they get really high. But you want to work with your body's natural healing response. And so the way I worked with it is it was swollen, but I knew that if I put ice on it, it would decrease the swelling, but it's not necessarily helping the healing. So I just massaged it upwards toward up my leg since it was down all the way at my ankle, just very gently, not in a way that felt painful. It was a little uncomfortable. But arnica also is really great for inflammation. And then I went into my bedroom and I put on a compressive sock because I knew, to me, when something's swelling in a way that's like going to be limiting, I want to hold it. I want to help with some compression. And so that's just a comfort. It's not going to decrease the body's natural response. It's just going to kind of harness it a little bit. So it's not all, especially in the ankle where you just don't have it's a lot more to pump back up into the body. I woke up in the morning and it was significantly less swollen. And then again, I put arnica on it, massaged some of that, just like up. And I didn't wear the compression sock anymore. And it was like the next day, it was kind of crazy how much it improved. Now that was a very deep bone bruise. It wasn't a soft. So bone bruise is very, very painful. You'll get a lot of swelling. But you might get a lot of swelling with a twisted ankle as well, but you could really do the same type thing. I have gone in with really newly sprained ankles and gently done that same kind of myofascial. It's just like kind of milking some of that. I call it inflammatory soup. Like too much of it is really going to be harmful because then you can't move and it's like this, you don't want to move too much, but you want to keep it moving so that it doesn't gather. And so I guess the long answer is I'm not a fan of ice anymore. I did used to use ice. I think it can still be appropriate at times, but for this, I would really try and let the body do some of its natural things and then help it out in a more productive way.
I mean, I agree with you. I think ice still has its kind of analgesic
Yeah, it's
properties,
really good
you
for
know,
numbing.
yeah, for
Absolutely.
numbing. And that's a short period of time, so that's kind of what Laura's talking about. What we've seen, it used to be RICE, rest, ice, compression, elevation. And that's what everybody did. After an injury, that's what you did. And then they started seeing that people were icing so much that it, to her point, it decreased the healing. You actually are, going into vasoconstriction. So you're not getting the blood flow, the nutrients for healing. You're actually decreasing the protein production for healing. So, I mean, ice I will use as an analgesic versus thinking of it as decreasing inflammation, because there's a huge question mark in the literature as to whether or not that actually happens. To your point, Laura, what she's describing is more of kind of a newer uh, acronym is MEAT, which is MEAT, movement, exercise, analgesic, and then what's the T? The T is treatment. So,
Mhm.
uh, actually, we're finding getting things moving. That's exactly what you did, Laura. You did a manual movement with your hands. You probably could have also done you probably did some gentle range of
Yes.
motion just to help flush that fluid out. Knowing you were going back to bed, I absolutely would have put on a compression sleeve too, because you're not going to be moving in the middle of the night. But if it's something that you do during the day, and that would be an ankle sprain, keep it moving, help it to heal that way. Take some Tylenol, take something to decrease the pain, because the pain is going to inhibit your movement, which will therefore inhibit your healing. I mean, I'm an Advil fan. I do like the anti-inflammatory properties of Advil, but you have to be careful with either one. You
Mhm.
don't want to become dependent on it. And then most people that I know, they like heat. Let's be honest. Heat is going to make the muscles relax. It's going to allow for more movement, which is going to allow for more healing. If somebody just had a huge ankle sprain, am I going to wrap it in heat? Probably not. but the next day, you bet your butt I'm going to be doing some sort of, movement, and maybe starting off with some heat before then, might feel good. So, knowing that neither ice or heat has a lot of uh, evidence behind it in the literature. So do what feels best for you. If ice feels better because it numbs it for a little while, do that. If heat feels better because it loosens it up for a little while, do that. Whatever it takes to get you back to moving, which is exactly what Laura did. By the next day, she's up, she's moving. It probably still hurt, Laura, but you don't
Mhm.
fear the
Yeah.
pain. So you
Yeah.
just kept moving and allowed it to heal 10 times quicker than if you'd done the old rice, rest, don't move, and ice every 15 minutes. They still prescribe that, by the way, in the hospitals. Despite all the literature, it is pretty funny, ice 15 minutes on, 15 minutes off. It's so antiquated. I at least appreciate that they're saying 15 minutes, keep it short. So
Yeah,
you're
something
not
like
getting that.
like post-surgery
Yeah.
where there is gonna be, like, healing, but there's gonna be extra like, that can be, like you said, just the analgesic property, whether it actually decreases the swelling, but it's gonna, like, post-surgery, that can probably help in terms of
Yes.
the, the just discomfort.
Yeah.
So, I think that's yeah. I think when we talk about, like, healing versus being uncomfortable, like, also take that into account.
Yeah.
Um, yeah.
All right. So we also had a question from Megan, who wrote in and said, "What are your and KB's opinions on NKT as a modality of physiotherapy? There seems to be a divide in opinions. Curious to know what you both think." And so NKT stands for NeuroKinetic Therapy. And I'm not super familiar with NKT. In fact, I had to kind of look it up. I'd heard the acronym, but I had to look it up to be certain. And so my understanding of it from the internet is that it's a different way to do manual muscle testing. And so that is a very common practice in physical therapy. Somebody comes in, I test their muscle strength. And what does that tell me? Well, that can tell me if we have an imbalance, so if one shoulder can hold the arm out with no problem, the other one falls down. Well, that's a pretty obvious imbalance. We grade it, all this stuff that's super subjective and, not very clinically relevant inter rater reliability. It's got pretty good intra, like my grades would be the same, but if I tested someone and Laura tested someone, they could be very different. So my understanding of NKT is it's a similar type of, maybe more comprehensive, where if someone comes in with back pain, they're going to manually muscle test multiple areas and then get a bigger picture of maybe strength dysfunction in the body. So I think I can understand why there is a fair amount of differing opinions. There, first of all, on the internet, there's differing opinions on everything, and we have to really take into account that the literature is super biased. We can no more base everything we do on evidence than we can base everything we do on personal experience. There's got to be a mix of the two. So when I hear something like this, what always gives me pause is high that it highly relies on a therapist to do manual treatment. And this is coming from a manual physical therapist. I'm a manual PT, meaning I have healed people with my hands for years. And it was getting out of that frame of mind that I'm fixing someone into this frame of mind of I'm teaching someone how to fix themselves through better movement has really helped me balance the two. I still am a huge proponent of manual therapy. It works, it has its place, but it shouldn't be the sole thing. And I don't come into any situation thinking that I'm fixing someone. I simply look at the body. So, and that might be through manual muscle testing. And I am looking at, yes, those imbalances. And then I'm trying to figure out, how can I help somebody learn to move better? And it might be with some boring exercises, but that they are doing, that it's patient driven. So that would be my biggest kind of red flag is if it's heavily reliant on a PT. And I don't know enough about NKT to say either way. And then also the strength of the therapist, how much that takes a lot of experience. When I first started off with a lot of my muscle energy work, a lot of my manipulative skills, when you're starting off, you pretty much suck because you just don't have the touch yet. It takes a lot of practice to get good. It takes a lot of practice to get comparisons. Just like Laura and I, when we're teaching teachers how to observe bodies, they're so shocked by how quote unquote easy it is for us. And it's like, well, we've been observing bodies for 25 years, 50 years between the two of us. So like it's experience related. So I think that can heavily bias an NKT practitioner. Everybody's got to start somewhere. I've been there before, but I think that can sway some of those opinions for sure. I mean, that's my biggest thing on it, not knowing much about it. Laura?
Yeah. So, yeah, for me personally, I'm so much like you. I am, there's so many things to say about it, but I want to teach, I want to educate, and I want to talk about function. So when you talk about muscles being tested, that is not very functional, because muscles don't work as islands. They work in a collaborative sense, or they don't. So, do I test somebody on their serratus anterior? No, but I test them, that will reveal there probably is serratus anterior weakness. And so it's a collaboration. I'm always like, I think that it's not very empowering for the person you're working with when you're doing like those kind of individual tests. Oh, this is a lot weaker than the other. We know that, but like, what does that mean? And what can we do about it in a functional way? So, for instance, in lit, we do a lot of like forced use, which is putting weight on one side and then the other and changing the levers. So it changes the demand, where you might have biases and you might have created some weaknesses. To me, that's going to have a much bigger spillover effect. And that person can, again, go away from us, go away from a class, a private, and work on it. So if it's a way of identifying, where there's muscle differences, that's, I guess, could have value. That's not something that I would find valuable personally. If I was going to go and do another training, I want to see like, what can I learn in a training that is going to have, that I could teach to 50 people, each of them having differences in their own bodies, but that it's going to have more of a global impact, functional impact. So those are the things that make me a little bit like, "Hmm." So if I were to learn anything, I would want to learn like, how do I teach somebody how to kind of connect with their nervous system and have a little bit more understanding. And I would do some of that through myofascial stuff, but I'm not necessarily saying like, this is it. While you're with me, I'm going to help you feel what it's like to be in maybe a more grounded, centered state. If we help some tissues like get less restricted, that is going to have, that's teaching them like what that feels like, and then giving them ideas of like, okay, you could do this by stretching this way, by doing this mobility drill, by paying attention to your posture, all those things. So movement is really complex. So when you bite size it into certain things, that always gives me pause.
And you know what's funny, what I found, especially because I do so many more Zoom
Mhm.
sessions, what I love about the change that's happened in my practice is I've turned my quote unquote manual muscle tests into, more of a movement
Yes.
test. So
Yes.
when you brought up serratus anterior, I was just at a private yesterday, and this gentleman was having some shoulder issues, and so I in fact got him on all fours, and I did some, scapular puffs just to say, all right. And the whole time I'm watching his quality of movement, and then I had him put the affected arm behind the back and do the strong side. And my thing for him was like, after he got done, how'd that feel? And then he told me subjectively, it felt good, it felt strong. And then, all right, now we'll do the other side. And then he goes and does the other side. Well, how'd that feel different? And it's impactful for the client because now they have a relationship with the movement.
Mhm.
Give a crap that I'm looking at what their serratus may or may not be doing, because let's be honest, that's not just testing serratus, that's testing a lot of things, but
Yeah.
it's the quality of movement. It's that neuromuscular. And wow, that felt really hard. I had a hard time even starting the motion. So like that's way more information than if
Mhm.
I had manually muscle tested this serratus in and of itself. And so I think, that's been such it's been a challenge to wrap my brain around that, but I'm still seeing a comparison. All right, so I think qualitatively say, not necessarily quantitatively, but that right shoulder girdle is weaker than the left. Maybe into protraction, maybe the serratus is weaker, but I'm really thinking more in terms of how is that? And then it's what's really fun is then we go do a bunch of other things and we, do some functional movement and then we come back to that exact same test and they're mind blown by how much
Yes.
better it feels and
Right, because
we just grab a
it's
weight
that
and do
dialing in. Yeah.
dialing in. Yeah.
Yeah. So, I mean, we never wanna, like, poop on any other thing, but it's just like, if you're gonna spend time learning something or paying for something, you wanna have the outcome be, as maximal as possible, and I think there's just the functionality of any kind of isolated muscle testing as a ma as a way of as a tool is I think it's gonna be limited.
And I mean, they have to do it. That's what insurance companies want.
Yeah.
So we know that, but just, yes, it's another tool in the tool bag. All right. Do we have
Okay.
another?
Yeah, we have, this is from SR Genelet. Piriformis syndrome. My sister was diagnosed with this recently. Can you explain what it is? Exercises to help out. When you think of summer, are you thinking of all the wonderful things like fresh corn on the cob and barefoot, feet in the grass, sand, swimming, sunshine, and just feeling long, beautiful, bright days of light? Well, we're celebrating summer again with our fabulous Summer Spritzer series, which is completely free for you and for any of your friends as well. I started a Summer Spritzer series 5 years ago in my first summer of having the Lit daily online platform, and it was so popular, we've brought it back. But we've renewed it, refreshed it, added more people on it, and it's there for you. 12 days of free classes. So go to the link in bio and sign up and share it with friends as well so we can all get spritzed and sunny together.
Yeah. So piriformis syndrome, for people who don't know what the piriformis is, it's a muscle in your buttock. Basically, it comes from your sacrum and it's shaped like a little pyramid. So it's kind of easy to think about. It's like a triangular shape and it goes right over to your femur. That's that bone. If you push on the outside of your hip, it's what everybody thinks of their hip, but it's actually called the greater trochanter of the femur. It's that protuberance right on the outside of the hip area. And so what's unique about the piriformis, it's a deep rotator, so it's a deep stabilizer. It has a couple of unique things about it. It's when the knee is below 90 degrees, it externally rotates the hip, so it turns that femur out. When your knee comes above the level of the hip or the hip is flexed above 90 degrees, it becomes an internal rotator. So it's got this unique ability to, really control that rotation depending on position. The most unique point about the piriformis is it runs right over the sciatic nerve, or the sciatic nerve runs right underneath it. And studies have even shows, studies of cadavers have shown, I've seen anywhere from 10 to 20% of people that the sciatic nerve actually pierces through. In some cadavers, they found it go through the piriformis, which that makes it an important muscle in that the sciatic nerve is our largest nerve in the body. It's the size of your pinky. So if you think of every other nerve being more like spaghetti or linguine, you got this big fatty going right through your butt cheek. And then if the piriformis gets tight or restricted, it can push upon that and can really exacerbate and or cause sciatica type symptoms because of that close relationship to the nerve. The same thing happens up in the neck with our scalenes that run right by all the nerves that come out of your neck. If they're tight or restricted, they can, any muscle that's near a nerve can affect it. And so back in the day, piriformis syndrome was the hot diagnosis. I mean, I had people coming in that were getting their piriformis injected. I sent people for piriformis injections. I worked really closely with a pain doc, and I would come palpate where that knot was, just like a trigger point, a muscle spasm. I'd put a little smiley face, doop, send them right over to the doc. They would inject that thing, and it would help it to release. So, this was back in the day of, quick fix. And that's not to say, then they did physical therapy. We would do a lot of stuff to retrain how they moved and blah, blah, blah. Now being reformed into looking at the body as a bigger unit, I think that we need to look further than just the piriformis. It absolutely plays a role. Piriformis syndrome, it's probably involved, but what might be failing elsewhere? What's the pelvis doing? What's the core doing? The deep core, even your iliopsoas in the front, is it, how can we create balance to take whatever torque is occurring off, or whatever tensions that are occurring off of this piriformis that's going into spasm. So, to answering that, I think that's Sandra, answering Sandra's question is multifactorial, because this is another case where I could tell you, all right, I want you to do some piriformis retraining. You're gonna put your knee on a stool. You're gonna externally rotate the hip with resistance, 3 sets of 20. Then you're gonna go stretch it. I promise you that will help. But you're going to get it again down the road if you keep doing the other stuff that you're doing throughout the day. It's very common in cyclists, very common in runners. So, looking at your bike, how your bike fit, looking at your job, how you sit, looking at your shoe wear, looking at how, even your chair, people have ill-fitting ergonomic setups. There's so much that can go into giving this type of symptom, that it's tough to give an exact prescription. What do you have to add to that, Laura?
Yeah, I totally agree. And, it's so funny. I had a private 4 days ago, and she had been diagnosed with piriformis syndrome, maybe 30 years old, been doing PT, wasn't helping, blah, blah, blah. So first of all, the diagnosis, like any diagnosis, can be helpful because it sometimes helps your brain just itemize something. Like, there is a reason that I have this sensation, whether it's tenderness, whether there's some numbness or tingling down the leg because the sciatic nerve is getting compressed. But always it comes back to, like, what's the root cause? And it's usually because of dysfunctional movement or less optimal movement patterns that have, or sitting a lot, that have just created more strain on the piriformis and surrounding muscles, because some other muscles are not supporting the pelvis and stabilizing the sacrum. So sure enough, this woman, I would ask her to hinge at the hips, very hard time hinging at the hips, started to say, oh, I feel it, I feel it. I was like, keep going, you're fine. Like, that's the other thing is, you feel something like that and it feels like, oh, I shouldn't do whatever I'm doing. No, you have to that's one of, there's a few times we'll say, like, feel that, but that is not accurate in terms of what we're doing now. We're actually doing really good hip flexion, and it might get, some of the fascia might get tugged on, and you're just having that immediate response, but it will improve. And, you know, all the things we worked on, like the position of the rib cage, the position of her pelvis, how to flex at her hips. She wasn't doing that. She was just tipping pelvis forward and back over and over, wasn't able to access like really good responsive glute muscles that would both move the hip and stabilize the pelvis. And she wrote me today and was like, I've been doing that. I can't believe it. I feel so much better. And guess what? She feels hopeful. So
Mhm.
it's like the reason she feels hopeful is when you get a diagnosis like that, it does feel kind of heavy. Like, wow, it feels like something is being done to you and you don't know what to do. And I think the diagnosis is just to give you an idea that this is where you're having the impact of your imbalance, but let's look where that is creating. It's like to Kristen's point, we could do analgesic things to take away that compression, that sensation of pain, but it will return if you don't change your movement mechanics. This is true for like Achilles tendonitis, any of these itises, syndromes, etc. And so just, yeah, look at where it's coming from. So tell your sister, well, help her out. See what her new, like, does she know how to stand tall? How is she sitting during the day? Is she moving in a variety of ways? If you're not moving in a variety of ways, you're kind of getting all that tissue stuck. It's not, but we need to stabilize the pelvis as we're moving in the hip, as we're bringing the trunk, flexing at the hip and bringing the trunk down so that weight of the trunk isn't pulling on that tissue and stuff. So tell her to do a reset. And by the way, Kristen's got an amazing Piriformis or sciatic series. And to me, low back, sciatica, Piriformis, they could all be under the umbrella because something in the movement pattern creates some variations in the expression of it, but the root issue is similar. And so check out her series on that.
Absolutely. And I also love that you made the point when she said, oh, but that hurts. It's like,
Yeah.
that's okay. That's all
Yeah.
right. Giving
Yeah.
people
So
permission
it's
to
right.
move.
Like, it's like, because then you're going to guard. Guess what? You're going to make it worse because you're
Mhm.
guarding. Then you're not moving as much. And then, she's too young to not be moving like this. You're okay. This is something, there's an imbalance. Let's work on that. And over time, and for her, it was 2 days over time, all of a sudden the brain's like, oh, okay, you're moving well. And I don't have to like respond in the same way. So it's also, it's all intertwined. So if anybody is treating it, just treating there and not looking elsewhere, then find somebody else.
Red flag. Yeah.
Yeah. And it's not their fault, most likely. It's the system. But yeah, look at the whole thing. All right. We love you. Write us on Instagram with any questions. You can find me at laura.hyman or Kristen, KB Williams 99, or our Lit Method IG. Make sure you follow us as well. And that helps you stay updated with what's happening. And we give tips on there for all these things.
Yeah. You can also write us via email if you're not a social media person. Support@lityoga.com. Those get forwarded to us. In fact, many of ours today, the last couple of sessions have come from the email. So, don't forget that is an easy way to send us your questions.
Check out the posture series. Check out all that, if you go on, the amount of stuff we have on there is nuts. I think even our regular members are like, oh my gosh, I had no idea it was there. It's kind of like a little bit like Christmas. You'll find some treasures that you didn't know were there, but you can always search in the search bar for specific things you want to work on, or just know that every class is addressing the global system of movement.
Yeah. Well, and it's also been, I think, fun since we changed our homepage to where now you get 7 days in each different level, beginner, intermediate, and advanced. So people feel like they get, this reminder of all these classes that we have because we're refreshing them every single week. And it's like, oh, I forgot about that one. How much fun is, so that's
Yeah.
fun too.
So fun. So fun.
Okay.
As always,
We're
we're pulling for you.
Oh, it's probably better if you do it. I love it.
Thank you for joining us on this episode of Redefining Movement. If you like what you've heard, please like and subscribe wherever you get your podcast. Feel free to leave us a rating and review or share with someone you know. Check us out at www.litmethod.com.